Hello and welcome to Vibrant Lives podcast, formerly Amanda's Wellbeing podcast. This is a podcast dedicated to health and well-being, featuring interviews with experts in the areas of nutrition, physical and mental health, and my 5-minute food facts series. I'm Amanda Hayes, your host, a lawyer turned nutritionist with a deep curiosity about living a healthy, active and fulfilling life, which I would call a vibrant life, and sharing what I learn with you on this podcast. Before I introduce today's guest, I will mention that, although I will often be speaking with experts, any advice or information provided in Vibrant Lives podcast is not intended to be used to treat, cure or prevent injuries or medical conditions, and it is never a substitute for advice from your own health professionals. Today, I am here with podiatrist Tom May. My personal experience has been that feet are easily ignored until something goes awry, and then you realise what an important part of your overall well-being your feet are. Problems with your feet can have a huge impact on your quality of life, and that's where podiatrists come in. So podiatrists are experts in foot, ankle and lower limb health, and they can help prevent, diagnose and treat a wide range of conditions. And today, Tom and I will chat all about that, what podiatrists do, our biomechanics, and how to best look after our feet. Hi, Tom. Welcome to Vibrant Lives podcast. Tom, you're the first podiatrist I've interviewed, so I think there's a lot of things we can talk about. Before we learn about the wonderful world of feet, I'd like to understand how you came to be a podiatrist. So podiatrists, I believe, fall under the banner of allied health, like physiotherapists, dietitians and psychologists. So in the world of healthcare, what drew you towards podiatry specifically?
Thanks, Amanda, and thanks for having me on. I guess from my background, I actually never knew what a podiatrist was until I actually started studying, and a very close friend of mine who I practiced with for a number of years. His background, for example, was one of which he'd actually seen a podiatrist, and I think this is how a lot of people perhaps get into allied health via a previous experience they'd had growing up, and thought that's perhaps what I want to do, and when I finish school and grow up and into the big wide world. So I hadn't had that actual experience. I was interested in science, and unbeknownst to me, I didn't know I was interested in health science. And you're quite right, podiatry does fall under the allied health banner, and I actually studied environmental science. That was always what I was passionate about at school. And then I guess spent a year or so at uni studying that first, and it was actually my older brother, who I always and still do look up to, that said, and generally anything he says I've followed in life. So he said, hey, I think you'd be good in the health space. So, and he actually took it upon himself to go and get the information for me, and physio is the first thing that came to mind.
Yeah.
And it turns out I hadn't done physics at school, so that was a prerequisite to get into physiotherapy.
Really?
Yeah.
I don't think it is anymore, is it?
Yeah, I'm not sure. I'm not actually sure. But I'd done biology and chemistry and science. That was sort of what I was interested in, as I said. And so podiatry sort of came up, and I applied to do that. And as it turned out, it was very, and it still is, to my knowledge, very similar in first year as a first year curriculum, if you like, anatomy, biology, physiology, etc. So I thought, look, I'll do it for a year, see what it's all about, and I think by the end of that year, I'd sort of perhaps been drawn to some sort of passion around what you did as a podiatrist, and no longer had sort of knew what physios were, because I'd done plenty of injuries playing sport growing up, so I sort of knew what a physio was, and perhaps decided that wasn't for me, but as I said, drew this passion towards podiatry.
Yeah, that's so interesting. And how long does it take to become a podiatrist?
Yeah, so at the time that I studied, so I finished my undergraduate study, I finished in 2004. It was a 3-year degree at the time. I've actually been involved with teaching for the last 12 years. It actually moved to a 4-year program, I think around maybe mid-2000s, 2006 or something like that. And that's, I think, to keep it in line with most of the other allied health studies. And I think sort of, in my opinion, it probably felt like 4 years was crammed into 3 when I did it. So,
Right.
Yeah. So it's pretty, I think, across the board, most sort of tertiary undergraduate degrees are 4 years now anyway. So I think it's to keep in line with that. Anyway, long story. Yeah, it was 3 years at the time. I then did a Master's of Health Science in Podiatry, which was a coursework master's degree. I started that in 2006 and did that part-time while I was working full-time until I think I finished around 2010, 2011.
Right.
Yeah,
So you've done quite a lot of study along the way.
Yeah, enough.
Yeah,
for me anyway.
Obviously a lot to know about feet.
Yeah. And I think the best part of I think the best thing about doing postgraduate study was actually having worked for a period of time and then being able to then clearly learn more, but used sort of some experience that you'd had in the field, and then with a bit more understanding or perhaps different perspective when you've gone back and studied again in whatever that might be, I think.
Yeah, I think that's really true. And you can also tailor the study to what you're really interested in because you have more insight by then.
Yeah, exactly. Yeah.
So can you tell us then what podiatrists actually do? I mean, I think most people think feet, but there's probably a little bit more to it than that.
Yeah. Exactly. So that's clearly the first recognisable thing we do with a foot. By definition, we're from the knee down or just below the knee down. Okay. But I guess it refers to any foot ailment. It could be a skin issue or a nail issue. Right. It could be a sporting injury, for example. That's a soft tissue injury. So it's quite broad in that sense. And then perhaps more, and what we're seeing more recently, across allied health in general, or certainly podiatry and physiotherapy, where I've worked closely in that space, is sort of not specializations in the right word, but focus interest areas of individual practitioners. Yeah. So as you're aware, mine's sort of more aligned to sport. So I'm probably seeing more injuries pertaining to sport than might be perhaps skin and nail care and those sorts of stuff. So that's sort of where it fits in. And if we're dealing with an injury pertaining to the foot, it's the person that's sustained that injury. So an understanding of their overall well-being. So we've got to go more proximal to the knee, or we've got to go above the knee to obviously have some awareness of that particular person, but perhaps also of a previous hip injury they might have had, or a lower back injury, or just their health in general. You've got to understand the whole lot, even though we're only perhaps involved with the bottom.
Well, it's all connected, isn't it?
Correct, yeah. That's the thing. Sort of getting at.
That kind of leads me to the next question I had, which is, as a person with a sore foot, for example, how do you know whether you should see a physio or a podiatrist? Like if I had a sore foot, what would I do? Yeah,
that's a great question. And I actually discuss this with, people quite frequently, because it sort of comes down to your own circumstances and also your own perception of who I need to go and see.
Yeah.
And, so many acute injuries perhaps would typically, so someone sprains their ankle on a weekend, they're probably inclined to typically go and see and I'll use this as an example, certainly a physiotherapist or even their GP as a first point of call. It's not really a podiatry thing. Podiatry public perception is, I don't go and see the podiatrist. Now, I've just said it's from the knee down. It's kind of right in the middle of what we deal with. So the anatomy that we deal with, and it's just what happens. So in that regard, in my clinical area, I'll see, perhaps, to use an ankle as an example, I might see a chronic ankle issue over an acute ankle issue.
Right.
So someone that's had chronic ankle pain over a period of time and may have seen several different people and wound up seeing me for opinion or advice or management or whatever it might be. So And going back to your question, I think yeah. So I guess if it's foot related, I guess technically anything foot related. If I've got a sore foot, well, that's us. But a sore foot also goes and sees a physio, or could see anyone, an osteopath, or could see a doc or whoever else. So it probably depends on type of injury, and we might be a primary source of care for someone, or it might be more referral based. So it might be facilitated via a GP. I mean, an ingrown toenail, there's another one that's a common ailment that people, perhaps if someone's known that a podiatrist, have seen a podiatrist before, they might suggest or know of a podiatrist treating that, they go straight to them. But that would commonly wind up at a GP as well. Yeah. And then get referred to a podiatrist.
Well, my experience coming to see you was via referral from a physio.
Sure.
Sorry if you can hear a bit of background noise. We've got some renovations going on. So, Tom, what are then the most common types of injuries that you see in your clinic?
Yeah, I think it's, as I sort of alluded to before, my area of interest, and most of my area of practice is in sport, of all levels, I might add as well. So sort of from elite through to anyone
weekend warriors.
Weekend warriors. That's a good point. Yeah, that's a good one. So it could that's sort of where that lies. So I might see some acute injuries. I might see sort of typically, perhaps in a runner, for example, some overuse injuries. Yeah. People might be aware of things like plantar fasciitis or shin splints, and I'll use generic sort of diagnoses there, if you like. They're probably two of the types of injuries. And I think, just going back to your previous question, I think when it's from a referral source, in sport, you can't, and certainly in my opinion, I can't work wholly and solely to best manage, your particular issue, for example, Amanda. So I would say, if you're referred by your physiotherapist, they're referring to me for a particular skill set, not to do the same thing,
Oh, absolutely.
Yeah. For example, Amanda's running and she's got an issue, and, referral to Tom, is she in the right running shoe? For example, or do I need advice on a particular stretch or strengthening advice, or these sort of things? So that might be where it fits in. Yeah,
like my personal experience has been, as a very average athlete, in my case, I still need a team of people. Yeah. A physio, you. Yeah. As you say, everyone treats something slightly different, and because it all is related, you need to deal with each issue.
I think as well, I'll just jump in as well, man. I reckon with the other relevant thing as well is kind of, one is where I practice and the circumstances of my patient, if you like. So if I don't want to, I can't set them up with a network of people to help them out if that's relevant, if it's not appropriate or not suitable for them, or not, and achievable for them. So it's got to be an individualized approach.
Oh, totally.
Yeah. And I might be, and I'm lucky enough to work with an elite sport team that have, these individuals or athletes have a massive team around them.
Yeah.
And the weekend warrior doesn't necessarily. So we've got to work out what's the best sort of team around them and to facilitate where they want to go or what their goals essentially are.
Yeah, absolutely. Well, that makes sense. And I'd like to talk about sports and biomechanics, but just something I've wondered is can you tell anything about someone's general health just by the state of their feet, or not really?
I try not to.
Yeah.
I try not to. I think it's very... I try not, but in saying that, you find just because it's what you do. And I'm perhaps interested in, like you say, biomechanics, so movement and how people move and the way they move. And you can't not help, find yourself, analysing, I guess, how people move and how they stand and perhaps what their foot posture or structure's like. But at the end of the day, it doesn't really matter. There's people with really bad feet and really bad biomechanics that function and achieve incredible things.
Sure.
So it's sort of fraught with danger, sort of the if we just look at that alone and not understand someone's history, I guess, and where they've come from and what they're capable of doing.
Right.
In light of their feet.
You're not jumping to conclusions.
Correct. Yeah.
On...
Yeah. Because we know the longer I've practiced, the more I've seen that, especially if we're sort of looking at an aesthetic type thing or looking at someone's feet and suggesting or feet or foot posture or whatever else it might be, and making assumptions that because of that they've had issues or they're going to have issues. I don't think that's helpful for anyone. And conversely, perhaps a very good looking foot, if you like, might run into issues as well. So there's no perfect foot. There's no bad foot, really. Yeah.
No, I guess everyone is completely different, aren't they?
Yeah.
So, and that's where you come in. You look at the issue at hand.
Yeah.
And
I think
help. So before we talk about biomechanics, I'm quite interested in learning a little bit more about orthotics, because I think that's another thing people think about when they think of a podiatrist. Yep. So first of all, what are they?
You've opened up a can of worms here.
Dear.
Okay, so, I guess put simply, an orthotic's an insert or an insole that's fitted to or placed in someone's shoe. Now, I think it could be anything as well, like by definition. So it's not just a custom orthotic. It's not just an orthotic that perhaps comes from the chemist. Their utilisation is widespread.
Right.
Okay. So it's not just podiatrists that are prescribing them as well. And it's so they're widespread. It's probably, and there's no, I guess straight from the outset, there's no right orthotic. There's no one type of orthotic that's for everyone or anything like that. Yeah, it's got to be individualized. What was your specific question there?
Well, I wonder, I don't want to talk about the kind of thing you might walk in and buy off the shelf in the chemist.
Yeah.
If I'm coming to see you and you assess that I need an orthotic, what kind of things would that be for? Like, when would you prescribe an orthotic?
Let's try and break this down. So often, in a circumstance which an orthotic might be utilised, they've historically been prescribed in a space of realigning you.
Right. Yes, that was my understanding.
Yeah. And that's actually how I was taught. Now, I finished in 2004. It's still how I was taught at the time. So they realigned your body. We now know that that's not the case. Like, we have enough evidence to suggest that's not the case. And even if they did, it's inconsistent. Like, if they were able to realign you, it's not consistent one person to the next. Okay. So we know they work. So, and when I say work, we know that they improve pain and function. We've seen that. We've seen improvements in symptoms. So we just aren't 100% clear on the mechanism in which way they work, like a lot of treatments.
Yeah, that's interesting, isn't it?
Yeah. And it'd be nice if it did. And we sort of look for simple answers or simple mechanisms of the way things interact. And work to produce a desired effect, but it's unfortunately not as simple as that. And if we're doing that, we're kind of oversimplifying it. So we know that they're, from an orthotic point of view, what we know that they have the ability to change or manipulate how force is applied to your body via when you're walking, when you're running on them. So if we can change that, we might be able to unloads or take stress off a particular tissue, okay, whether that's a tendon or a ligament or a muscle or a joint or a bone. So if we look at it as simple as that, and I think the other thing the other probably perhaps more tangible thing for your listeners and for people in general is that they go inside a shoe. So the outcome of an orthotic, whether to improve someone's foot pain or to improve their function or comfort, is the outcome's going to be the sum of the effect of the orthotic and the shoe that they're put into, because we can't just wear an orthotic and strap it to our foot. And that's often a very simple way of I'll explain it to a student that, in my students that I'm teaching. So we better get the shoe right as well.
Yeah.
And perhaps too much focus or emphasis is on an orthotic. And I think if we perhaps sort of look at them, perhaps just consider an orthotic and a shoe the same thing, and prescribing them, if we're going to utilize an orthotic, it's got to work with the shoe as well.
Yeah, well, that makes sense.
Yeah.
And I do want to talk about shoes, but before we do that, can you tell me, because even since I've seen you over a few years, there's been a big change in technology, I believe, in producing or making the orthotics. Can you just tell us how it's done? Yeah,
sure. So traditionally, and I prescribe orthotics, and it's not about the argument or debate over whether they work or not works. Like, let's knock that on the head, because you still have, they didn't work for me, or like they don't work for anyone. They work for everyone. There's a different orthotic or a different type of orthotic or no orthotic or a particular type of shoe. So something's going to work for everyone. We've got to find it. So it's got to be individualized. So the fact that Amanda, your friend, didn't get on well with them doesn't mean you're not going to get on well with them as well. Sure. And that's common across health, isn't it? So
absolutely.
That's probably the first thing. Anyway, technology. Yeah. So we've probably come from a space of, in podiatry, and it's relevant. That's what I do. So it's relevant to talk about that specifically from a means of, probably people may be aware if they've had the process before of plaster molding the foot. And then some fairly sort of traditional methods of then from that plaster mold of the foot, which gives us which customizes the orthotic that's made to their foot versus something that's sort of pre-made or generic made. What we're doing now, and what's pretty well widespread, or I'm not sure what the percentages would exactly be, but most podiatrists that are utilizing custom orthotics are scanning the foot.
Yeah, amazing.
Yeah, it is, and it's certainly improved our efficiencies. The quality of the scanners is fantastic. It's come a long way. So the ability to take a very accurate scan of the foot has improved, and that was probably not my resistance, but perhaps what I was afraid of, moving from plastic molding the foot to scanning the foot, that we were sort of perhaps missing something if the scanners weren't just producing pretty pictures, because the foot's very intricate, and we've got 26 bones and lots of joints. Yeah, very interesting. So if we're going to be specific or accurate, and with this customization process, if we're missing, if our technology, if you like, is missing a centimetre, well, we might be on a different bone or a different joint by then. Yeah, that's probably not a good result. No. So we're not getting, and if that's the starting point, we're really not trying to get a true accurate reflection of or impression of someone's foot. So that's probably where that's gone. And then from a manufacturing point of view, we're using 3D printing. Yeah, I think that is fascinating to me. Yeah. And the outcome as a client is that it's much lighter. Yeah. Isn't it? Yeah, that's right. So from a material point of view, we're sort of, I'm a minimalistic person anyway. So if we're using the ability to use less to achieve an outcome, and that's probably back to a conversation 5 minutes ago. Oh, yeah, I had some orthotics 20 years ago. I wore them when I was a kid, and now these, I had to wear a shoe that was another size big, and they were hard, and they made my feet sore, and all these sorts of things. And I inevitably put them in the cupboard and never wore them again. Yeah. So that's a really common story. It's probably still got that weekly. Well, now, these advances, if you like, or this ability to do this, has made the prescription and the features of them such that they are very comfortable to wear. Yeah. And if you're not comfortable, you don't want to wear it. Yeah, so, I mean that is really important, I think, because if it's uncomfortable, despite the fact it might be doing you good, you're still not going to wear it, are you? Yeah, that's right. And that's a common thing as well when on orthotics fitted. Should my knees be sore for a bit? Well, no. Yeah. Are your knees sore now? Like that's it. So for mine, it's got to be comfortable from the outset. If it's not comfortable, and and I get that with athletes. They're not going to push through. I can't have someone that runs 10Ks. They're not going to be uncomfortable. They're going to take them out of their shoe. Yeah. pretty quickly.
Well, that's a good point to talk about athletes and biomechanics.
Yeah.
So biomechanics is one of the things you're interested in your practice.
Yeah.
So can you talk to us a little bit about how do you actually assess biomechanics?
Yeah. Really good question. I guess what we do is what we have the ability to do is quite unique in that my colleague that I work with has a PhD in biomechanics, and it's his passion, and he set up our particular clinic, or the clinic that I consult and practice from, where we've got the only 3D gait lab, certainly locally. I'm not sure how many actually sort of privately across Australia. I'd have to ask him. Or let alone the world. So it's quite unique what we've got the ability to do. And what that is, if you like, I can ask you to. So if I want to assess you, for example, walking, Amanda, or running, I could ask you to walk up and down the corridor. I could ask you to run up and down the corridor.
Yeah.
But quickly you get away from me and I can't see you anymore. So it's hard to obviously see what you're doing. How do we do that? We get you on a treadmill. Then you're not moving away from me at all, so I can assess you. Now, my eye can only view you in 2D, so I can only see two parts of your movement, if you like. And and I don't have as good a video as my iPhone camera might have on it, or any other camera, for example, might have. It's very difficult to really accurately have objective measures.
Right.
So how much your knee's moving, for example, how much your ankle's moving. So that's what 3D gait analysis enables us to do, and that's via a series of Big Brother-like cameras that surround the treadmill, and they enable us to measure accurately, or what we would consider gold standard in terms of how you're moving.
Right.
Yeah.
So what kind of image do you get? Do you get an image of what the pressure points are, or how the bones are moving, or I don't even know. Yeah, and what we do, and so I'm trying to put this in sort of, it can get very complicated very quickly. Yeah,
and
keep it simple.
Yeah, correct. And certainly the data, or the objective sort of data and graphs of this movement that you get out of, you need a PhD to understand that too. But basically what we do is we put a sort of series, for example, in your knee, if we wanted to assess your knee and hip or ankle, or typically we'd look at all three of them at the same time, for example, or see how your knee's moving relative to your ankle when your foot strikes the ground, or etc., or how you're moving, is we'll put it's putting a series of reflective dots. Okay. Around your knee joint, and they create a model. And that sort of, you can demonstrate that if you like. You can see sort of that'll create a skeletal model, and we can see how you're moving. Yeah,
I think I understand, because I've had a few bike fits done.
Yep.
And they use, it sounds like it's probably a little bit less sophisticated, but similar sort of technology, and then you can see how your legs are moving in the cycling.
Have you had that done locally?
Yes.
Yeah. Okay, that's exactly the same. Yeah.
No, it's quite amazing, actually.
Yeah.
So once you've got this data, then how do you actually use it? If you find, for example, an inefficiency in an athlete's gait or something, can you then correct it, or help them correct it?
Great. And that's the next bit. And that's perhaps, I won't say the criticism, but it's the so what factor. Like, that's great, but what do we actually do with this?
Yeah, exactly.
And what do we do with all this information? Because sometimes it can become, Amanda is a runner and has a hip issue. We're trying to find a cause and effect here, and it can be a bit of a fishing expedition. Is it her knee that's causing it? Is it her ankle? Is it her lower back? Is it whatever? And so, point being, I think the probably the most appropriate answer to that is that we've really got to have a sound clinical question before we actually do an analysis on you.
Sure.
And so we're not moving, or I'm certainly not sending you for a gait analysis to find answers. I've assessed you clinically. I understand your background, your injury history, and perhaps the fact that you don't have much range in your hip anyway, for example. And so we have I understand you clinically, and then we use this information to help understand how you're moving better. Then with that might be perhaps an indication to work on your hip strength or your glute strength around your hip, or it might be, perhaps from a podiatry perspective, use a certain shoe. If we've got some objective like data or measurement that suggests, hang on a minute, this shoe, we have the ability then to retest as well, or this type of intervention or strength and conditioning program that we utilize, and we can then remeasure and see if that's had a positive effect.
Okay.
But the outcomes are still the same. I think clinically the outcomes are still the same. And this is where not everyone's got the ability to use this. Not everyone necessarily needs it either. But it's a case of going, well, you're interested in the fact that you've got hip pain, and so you want that resolved.
Yeah.
We're using this clinically to help indicate perhaps your treatment or management plan to resolve your hip pain, not to necessarily, we can change your mechanics, or to your answer, we might, there could be we might perhaps use some ways of changing the way you run perhaps and things like that. So changing your running gait or running technique or type of running that you're doing to be able to achieve that, whatever it might be, to achieve an outcome which is still the same. You don't want a sore hip, or you want to run 4Ks or 10Ks, whatever that might be. Yeah, because they're your goals. That's what we're trying to achieve.
Yeah. Well, that's from my point of view, that was interesting to hear that you make the clinical assessment first. Before you do the testing. So you're really using it, I think, is it more to fine-tune what you're looking for and being really precise, or?
I think that's right, and correct. And it would be to understand you, because if we don't have, if we just go, I think as well, perhaps a good way of putting it too is that if we just go and find, if I don't do anything and you just go for a running assessment, it becomes a so what factor, because we don't have normals.
Sure.
Yeah. And the fact that something's happening on your left side that's different to your right, again, I'm not sure if that's relevant or not. Don't know if we need to change it, because I haven't sat down with you and, we haven't spoke about, your injury or the background to that, or what treatment you've had, and what you're capable of doing. So, this sort of in inverted commas picture of normal, which it's a sort of a word I hate using, because that's what people want to hear. Is it normal? Am I running normally or not?
Sorry, sir, you're not normal.
Yeah, that's right. And I think, and from a running point of view as well, and people, it's all over. There's examples over YouTube and things like that of examples of runners that you would have questionable biomechanics, if you like.
Yeah.
But they're running really well.
They get the job done.
Yeah. They're winning Olympic gold medals. And you might go, or do something or run in a manner, or move in a manner that you'd go would be a little atypical from a performance point of view, that's going to achieve a desired result, or certainly be the best. So the obvious question, should you change that? And probably the answer is no.
Unless there's pain or something.
Yeah, that's
perhaps.
right. Yeah, correct. So if Amanda's moving in a certain way and she's got an injury, well, we need to work out. And again, it's in lieu of everything that's going on as well. It's in lieu of what Amanda's actually doing. She's trying to run 21K. She's got a marathon that's her goal that she's doing, or a 10K run, or she wants to run the city to Bay, whatever that might be. That's her goal or objective to get there. So there's also, for example, I need to understand your training history, or your training load, and what else you're doing, what else you do during the day for a job. All those sorts of things become relevant to your hip issue as well.
Yeah.
So it's all, I guess, long story short, it's part of a much bigger picture.
Yeah, it's very personalised, obviously,
absolutely.
And it's a bit like solving a puzzle.
Yeah.
One thing I think that's interesting in the running space is that years ago there was a real push towards, mid-foot strike and all that stuff.
Yeah.
And now it seems to be, and I might not be totally up to date, kind of let the person run how they naturally run.
Yeah.
Don't try and change their stride too much, unless there's a reason to do it, I guess.
Yeah, that's certainly right. There was probably that that strike pattern became topical when barefoot running became topical as well.
It did. That's right.
Because naturally when you barefoot run, you're going to run on your forefoot because it hurts to run on your heel.
It does, yeah.
So there was sort of at the same time, and we're probably on the other end of it now. It's less topical than it was then, but it very much so minimalist shoes as well, same time, because they're going to help you run on your forefoot, which mimics barefoot running, which is a more efficient way to run. It's not necessarily. It's a more efficient way of running if you want to run faster.
Yeah.
So 100-meter sprinter,
and
for
if
example.
You've grown up in the African savannah or something.
yeah. But if you want to run the 100 meters, for example, you don't want to have your heel touching the ground. You're going to run much slower. But if we're in the interest of perhaps running a marathon, there's actually very few true heel strikes, for example. So it's very. There are examples of it, and there are people that have the ability to change their gait pattern. But probably the easiest thing to do is like. We probably do have the capacity to make small changes to our running style. But if I ask you to run differently, that's actually more energy consuming for you to do that. And certainly when I think it makes sense to me that if you stop thinking about it, you'll go back to whatever is your norm or inherent running mechanics or running stride. So that's probably the two, and it's not a bad thing. It's not a bad thing, but we can use. I think it's more. I believe, in my opinion, I think it's more relevant to look at the type of running that we're doing.
Yeah,
so if runners are seeing me, and when I mean by type, like what does your training look like?
Yeah.
I'm just doing, for example, I'm running 3 or 4 times a week, and I'm running the same loop and at the same pace, and et cetera, et cetera. So that's my understanding of that. I can then dovetail, okay, let's look at what your training looks like and keep you running, but perhaps reduce your knee load or stress that's going through your knee or the knee issue that you've got via changing the type of running that you're doing, because that'll change the load on your knee, and see if we can get a positive outcome that way. Rather than actually, we need to change your mechanics, man. You're all wrong. You've been doing it wrong for years. Let's change it, sort of thing. Yeah.
As you say, that's pretty hard to do, I think, too.
Yeah. I think as well, it doesn't help people. Like, because often someone like, I'm running all wrong anyway. I'm running wrong, aren't I, Tom? Like, or, I've to your point, I've got shocking feet. Don't know, like, they've worked until now. So let's, so it's, I think the worst thing I can do is catastrophize it further. Yeah.
The only change I've made in my running has been to try and increase my cadence. Yeah. Not how my feet land or anything.
Yeah.
That's been good, actually.
Yeah.
Tom, footwear, that's come up a little bit. You mentioned minimalist footwear. And so there's been a lot of trends in footwear over the years.
Yeah.
So, Tom, let's go back to the basics. What is your take or your advice on using the, in quotes, right footwear? Like, how does someone pick the best footwear for them, leaving aside all these trends? Yeah.
I'm big on shoes, as you well know, and I think it's a vital part of potentially, though their prescription, as I've alluded to previously, is more relevant than potentially the orthotic's going to be.
Right.
Okay. Mm-hmm. Because the question I still get is, do I need an orthotic? Like, I've come to see you, I've got this issue, do I need an orthotic? Not, do I need to change my shoes? Right. It's not typically that. Or do I need a different shoe, or what shoe is going to be right, or what shoe is right for me? Now, what shoe is right for me is a really challenging one. And there's a myriad of shoes.
Yeah,
if you go to a shoe
many.
store, how do you choose? And we can really, retailers have, health practitioners in their advice to people of what to go and get, they have done it as well. We've all been guilty of oversimplifying it. And again, probably a common theme, like, what worked for your friend Amanda won't work necessarily for you.
Yeah,
so,
true.
And certain shoe types, the Asics Kano is great, but it's not for everyone. But it's a well-marketed shoe. It's a well-known shoe. So typically there's going to be higher sales of that potentially, or people are going to go to that because it's going to be the right shoe for them. So sounds really simple. But the first thing, it's got to be comfortable.
Yeah.
And there's with good correlation between finding a comfortable shoe and risk of injury as well.
Yeah.
So finding a shoe that's comfortable, getting fitted well for it. I think it's accessible and it's potentially cheaper to find something online, but that's fraught with danger, I think, as well. So I think going and have them fitted by a reputable place as well. And I mean there, like length and width of your foot.
Yeah, there's some good places around, like the running company, for example.
Yeah, absolutely. So the running company, your Joggers World, or now Sportitude Running. So there's places around you can get really good advice from and get really good service and get fitted really well for. And so that's probably the first thing. And it's probably not focusing too much on how you look in that shoe. So it's probably, so if a shoe we're saw, for example, is a treadmill to run on it and to assess your comfort and how you feel in that shoe, not so much the video that was taken and how you look in that shoe, because that's probably fraught with danger as well. And then we've got to find the shoe that's suitable for the purpose that we're intended purpose that we're doing.
Like trail running, sprinting, whatever it is.
100%. So if and that probably leads to a challenging thing, do I need 2 pairs of running shoes as well? Yeah,
absolutely. At least.
So, So the type of running you do, I run trails, I run distance, I run on grass, or it's hilly, or whatever else it is, and that's probably that. So if we can comfortable and we get something that's for the intended purpose, we're halfway there. Yeah. It's then about, if we then fine tune it for. If someone comes in and they're injured, I've got to be a little bit careful about, okay, well, you've got an issue in this part of your foot, therefore your shoe has to be able to do this and it's going to fix it. So we've got to be a little bit careful about that. But we do know that that's potentially helpful as well. Perhaps we've got an Achilles issue. A certain type of shoe might take away the stress on the Achilles. We know that intuitively that makes sense. And a shoe might be a different shoe might be a bit counterproductive in achieving that.
Yeah, because shoes have different, are they called drops? Like how much from the back to the front of the shoe, for example?
Exactly. And that's probably the point I was making in that example there as well. The other thing as well, it's individualized. So going back to comfort for a second, and this is what some colleagues in my practice are doing at the moment, there'll be some publication on, is what determines comfort. Yeah. We try and we hope that you just don't buy the shoe that looks the best, but clearly we're all capable of doing that. Yeah. But what someone likes is going to be different from the next person. So, for example, cushioning in the shoe, what factors determine comfort? We don't actually know. So we've done doing a really broad study at the moment in the practice where it's looking at what characteristics of comfort are important. So is it the width of the shoe? Yeah. Is it the cushioning in the heel of the shoe? Is it cushioning in the forefoot of the shoe? What are these characteristics that make up a shoe? Yeah.
For me, I think I like to feel snug but not too tight, and I don't like my shoe to be too heavy. Yeah. So, that's what the kind of things I would look for personally. Yeah. And certainly, I mean, lightweight's everything's about what, like a shoe, everything's about weight. So, and that first fit and feel of a shoe, and if it feels lighter, and you're going to be more efficient. If you're carrying around less shoe, you're going to be more efficient. So that's a good thing. And again, it probably stems back from my principle of, not advocating minimalist shoes necessarily, but like keeping it as simple as possible as well. And the other thing as well, also talking about running shoes, I'm probably more of the time suggesting a football boot or a netball shoe, it's sport-specific footwear that I'm talking about. And that's quite different again. So understanding the loads or demands of that particular sport and what's relevant from a fit, but also a function and a performance point of view in those particular shoes. Well, that makes perfect sense, because you wouldn't wear a tennis shoe which has quite a flat sole to go trail running. You'd be sliding all over the place. Yeah, that's right. And exactly right. So, and this, I mean, footy boot's pretty obvious. It looks like a football boot, and there's characteristics of that make it suitable for playing football in, but perhaps, a netball shoe is a bit less obvious. And that's been, over my years of practice, a really common one, someone wearing a running shoe to play netball in and
conversely. So there's particular types of sports shoe for a reason. They're built or constructed in a certain way that is suitable to play that sport in.
Yeah. I think probably one of the issues is that for parents it becomes expensive when your kids play football, netball, touch, cricket, you're like, oh, how many shoes do they need?
Yeah, absolutely. Multiple sports and growing feet.
Yeah. But it's probably a worthwhile investment from what I'm hearing.
Well, I think so.
Yeah.
Maybe I'm biased.
I hope you're biased. Continuing with footwear, I'd just like some quick responses from you on some day-to-day type of footwear, like, are they good, bad? What are the issues? So, for example, flip-flops, we call them thongs in Australia.
Yeah.
What do you think about them?
Not big on them.
Yeah.
No. I think there's some... there's Archies are a product that's pretty sort of well-known now, and I rate them. I think they're great. And again, it probably comes back to purpose. And I always... The caveat, client or patient of mine asks, what can I wear? Like an arch support sandal or thong or whatever else it is, or Birkenstocks or whatever else it might be. These are supposed to be quick answers. Sorry about it.
That's okay.
But it's always, make sure that's for around home or down to the shops, but it's not
all the time.
Yeah, for 8 hours on your feet.
Yeah.
Sort of thing. Yeah.
Well, that Birkenstocks was my next one. Is that any different from a flip flop or a thong? Or?
I suppose they're more of a sandal, and they're cork based, so they're a bit more solid. And they're probably it's probably to say they're better for your feet, it's a bit misleading, but certainly if you're on your feet for longer periods of time, something that's is more contour to your foot seems to be more comfortable than having your, sorry to knock them, but Havianas and things like that are going to be great for your feet. Yeah. And maybe sometime you don't often, depending on the person, sometimes barefoot's okay as well. It's probably a good thing, and it's a healthy thing to be doing.
Well, it
in
feels
the right
nice.
Absolutely.
I think, on the walking on the beach, for example, and and what about for women in particular? High heels, like very high heels, like stilettos.
Yeah, no good.
No good. No. Well, they're not comfortable.
Yeah. I'm not going to fight that battle with.
No. Yeah.
Yeah, they look good, but no good for your feet.
What about platform shoes, like in the sort of fashion sense? How people have like really thick soles on their sneakers or whatever. What about those?
I guess perhaps they're safe or okay to use in the right space again, but. You mean in an athletic shoe or like
I mean in a fashion shoe. My daughters have these, like trainer type shoes, but with really big soles.
Yeah, I think if you've got if you're really elevated, you're ultimately a bit more unstable. And this is so often often in the clinic, if I ask someone to go barefoot and perform something, they're more stable because they're close to the ground and they've got more awareness of what they're standing on. And there's a proprioceptive element to it as well, because their foot's in contact with the ground rather than having something between their foot and what they're standing on. Too much underneath the foot's probably a bit counterintuitive. And I suppose it's like, why is a football boot so close to the ground? It's because if you're changing direction at that speed, if you had a big platform underneath, you'd have no traction whatsoever. Yeah. You'd fall over. Or let alone roll your ankle or do something of that effect. Similarly, in netball or court-based sport or something like that. So too much platform, and I think
that's sort of common sense.
I think
probably,
so.
Isn't it?
Yeah.
So what about everyday shoes? What do you recommend? What do you wear? Well, I can see what you're wearing now.
Yeah, it probably comes back to finding something. I mean, I suppose in the clinic I'll wear a pair of boots of some sort. Again, it depends what you do. I suppose so in my experience, what I've seen is that, and there's some good brands around, like Baird Footwear, sort of do good work, or everyday shoes as well. Frankie 4, and there's some good like local retailers that'll do everyday shoes if you like. But it's probably more the feature of the shoe. I'm not a big advocate for the slip-on, for example. Like if you're doing, so it's the same sort of features perhaps. Athletic shoes, the easy one, because they're always comfortable and supportive. Yeah. But I can't wear my sneakers with my
suit or something. Yeah.
So we need to find something that's relevant. But I often find 25-year-old guy that works in finance in the city or something, and he's still wearing a horrible pair of dress shoes, but he's walking a K to his work and back from his office, for example. And these things are falling apart. So having a more robust or a better or a well-made shoe in that regard's a good thing as well, if he's going to do that.
Right.
Yeah.
So it's worth investing, I guess, for want of a better word, in some decent shoes.
I think so.
That won't fall apart.
Yeah. Comfort again, isn't it?
Comfort.
So, and generally, like, you get what you pay for, don't you?
Yeah.
Yeah.
So, Tom, I can't resist asking you this question, because what do you do if someone takes their shoes off and their feet really stink?
Put a peg on your nose. No, it's part of the job.
I bet it is.
It's part of the job. When people ask that, I sort of like, what do dentists do when someone opens their mouth? I think it's just, I don't know. I hope maybe you get used to it over time.
Yeah.
The funnier thing is people's reaction. They're either really worried about taking their shoes off when they've come to see you and you're a podiatrist, or they're quite happy to take their shoes off, and they do have very smelly feet and they don't wear socks and have poor foot hygiene and all the rest. So, yeah.
Well, I guess that leads to my next question in terms of, trying to eliminate foot odour if someone does have it. What do you do about that? Is that foot hygiene based, or
generally?
Yeah.
People like not wearing, general principles of foot hygiene, perhaps not frequently turning over their shoes.
Yeah.
And a lot of, or we're not even wearing socks, for example. So socks and shoes, which are made from synthetic materials that don't breathe.
Yeah.
So therefore, become more occlusive, and then, you sweat and those sort of things, and subsequently, smelly feet and foot odor and all the rest. So it's probably more those basic principles. Yeah, keeping your foot confined in a sweaty, hot environment for a long period of time. Yeah.
So to counteract that, we should keep our feet clean.
Yeah.
Turn over our shoes.
Yeah.
Wear socks.
Yeah, absolutely. Yeah. There's plenty of good socks on the market now too, like athletic wise or dress socks and things like that. So, yeah.
Shut up, Lenny. And just in general then, Tom, what are some tips for looking after our feet?
Yeah.
What are things that I mean, if you think about, you mentioned a dentist before, we should brush and floss our teeth twice a day. What should we do to our feet?
Good question. The first few that I've just mentioned, for some people it's more relevant because of underlying health issues, like to use diabetes, for example. We should be it sounds simple, but checking our feet regularly, okay? Sure. For, we've stepped on something previously, we've walking barefoot or something's got in our shoe or whatever. So simple thing of just checking your feet, cuts, abrasions, these sorts of things that might manifest into something more sinister. That's probably useful for everyone. So I think those things, I think from my end, and probably the athletes, for example, is just not ignoring foot pain as well. Yeah. Yeah. Mm-hmm. So I've got something that I'll ignore. That could be it. Now, that might even be it. That might be a skin or a nail issue, like a callus or a blister or an ingrown toenail. Yeah. Like, how long have you had this for? 3 weeks, and it's now infected, and it's nasty and needs antibiotics as well as, it needs or removal versus we could have treated it at the start. That's probably the key. It's like, don't ignore it, get it looked at, get it assessed. Yeah.
Okay.
Yeah.
Well, that's good advice. What about women who have nail polish on the whole time? Is that bad for their toenails? Do they need to see the light or does it not matter? Look,
I'm not the best person to answer this, but I think there are instances I've seen where, like, prolonged use will stain your nails. Yeah. So there's obviously some sort of toxin or something within the nail paint with prolonged use. And it's not suggesting that's going to happen to everyone again. Right. Everyone's different, but for females that do ask me the question, I'll typically say, why not just take it off when you don't need it on?
Yeah, like during winter or something.
Or forgo the need to have it then. So, I think putting paint on our skin or our nails can't be a particularly healthy thing to do. So,
intuitively it doesn't seem like it, does it? I mean, it looks nice.
I think that answers that one.
So Tom, to wrap up, what do you do to relax? What do you like to do?
You probably can gather, I love exercising and main passion's surfing. So,
Cool.
And that's got both a exercise component to it and just a mental relaxation and switch off for me, and being in the ocean, and so that's probably my main thing. And I supplement that with I'm into CrossFit at the moment. But
Are you?
Yeah.
Oh, my sister's crazy for CrossFit. She's even got a workout of the day named after her.
Oh, right. There you go. There you go. But I've got a 4-year-old, so chasing after them, I've just found that sort of perhaps a general fitness has been a sort of put me in a good space anyway. It feels good. So I've done the marathon thing and the cycling thing, but they're also time consuming as well.
They are
So,
very.
Maybe one day again, but that's probably how I would relax more than anything. Listening to music.
Yeah. Oh, nice.
Yeah.
And Tom, who inspires you?
Like personally, from a personal sense, family, I think. Yeah.
Great.
Yeah.
And I have a final question that I like to ask all of my guests.
Yep.
So if you could recommend 2 things that people could do to improve their well-being, it doesn't have to be podiatry related, just any 2 things, what would they be?
It was interesting when you just said that, because they're not podiatry things. And I think that's one thing I'll say what they are in a second. I think they're very simple. But over my experiences being a podiatrist, so it's about health and well-being in general, and that's what I've become more interested in over time, and where I fit in with that. And again, having someone's understanding not of just of their foot injury that they've got, but just their health in general is probably what I'm most passionate about. So first thing that comes to mind, exercise regularly and eat well. So, and that's probably what I try and do myself. So I think the benefits of living a better life, we can't ignore them. That's sort of for me, they're the 2 things. Yeah.
I totally agree. And it's not just how you feel physically, it affects how you feel mentally as well.
Yeah, absolutely.
Exercise particularly, I think.
I think so. And that combined with good nutrition, and you're sort of halfway there.
Yeah. And sleep's another good one.
More than halfway there. Yeah, absolutely. Yeah, get a good night's sleep if you can. If you've got a 4-year-old, I haven't had a good sleep for 4 years, but anyway.
Yeah, I think I went for, I don't know.
Catch up.
It takes years to recapture that sleep once you've had children, but now I sleep very well. The kids are much older. So Tom, can you tell us then, if someone is based in Adelaide, where can they find your practice?
Sure. So my practice is at 91 Kensington Road, Norwood, and the practice name is the Biomechanics Lab.
Great.
Yeah.
I'll put a link to that in the show notes. And Tom, thank you so much. It's been a real pleasure chatting with you today.
Thanks, Amanda. It's thanks for having me on. It's been really great to talk.
And that was podiatrist Tom May. Thank you for listening to Vibrant Lives podcast today. I hope you found today's interview with Tom interesting. If you did, please share the podcast and tell your friends about it. And if you could take a minute to leave a rating on Apple Podcasts, it will help people find my podcast. If you would like to subscribe to Vibrant Lives podcast, you can subscribe on all good podcast providers such as Apple Podcasts, Spotify, Spreaker, iHeartRadio, and YouTube. Please follow me on Instagram and Facebook, and check out my website at www.amandaswellbeingpodcast.com. Also, if you'd like to, please DM me or send me a message via the contacts page on my website and suggest a topic you'd like to learn about or someone you'd like to hear interviewed, and I will try and deliver that to you. Producing the podcast is a labour of love, and as many of you know, it has become my full-time job. I do dedicate a lot of time, money and effort towards producing my podcast. So if you enjoy my podcast and would like to support it, I would be so grateful. You can make one-off contributions via my Patreon page or via PayPal from the support page on my website. And another way you can support my podcast is by purchasing a book from the book reviews page on my website. If you click on the Amazon link there, at no extra cost to you, I receive a small commission when you buy a book. So thank you very much if you do that. Thank you for tuning in. Eat well, move well, think well.